Corneal reshaping treatment relates to the use of very specialized contact lenses that are worn during sleep to gently reshape the central curvature of the cornea. When you wake up in the morning, you remove these lenses. The cornea holds this shape for a period of anywhere from 24 to 48 to, in some cases, up to 72 hours, dependent upon numerous factors. And during that time, one's vision is clear without the use of daytime contact lenses or glasses. In essence, it changes the central curvature of the cornea, very similar to refractive LASIK eye surgery. The difference is that in corneal reshaping, it's a temporary change, and in LASIK eye surgery, it's a permanent change because you're actually removing tissue with the laser in LASIK eye surgery, whereas you're just changing the curvature temporarily with the use of corneal reshaping lenses. So the advantages that corneal reshaping gives you is the fact that you will have clear vision during the day without the use of daytime glasses or contact lenses, but that it is also reversible. That's a pro and a con. Some people really want a permanent treatment, but then there's no going back, and that is surgical. Others are interested in a treatment that can give them their daytime clear vision uncorrected, but they know for any reason things can go back the way that they started without any long-term complications, and that's where corneal reshaping comes into play. The other main advantage is in the use in younger individuals, because we believe through a variety of different research studies that the rate of progression of nearsightedness probably is slowed down, if not halted, by the use of corneal reshaping lenses in young progressive nearsighted individuals. We are a participating practice in one of the largest clinical trials of corneal reshaping called the SMART study, which is now entering into its third out of 5 years of clinical trial. The initial years of data are suggesting that, in fact, corneal reshaping does tend to slow down the progression of nearsightedness compared to individuals who wear daytime soft contact lenses or glasses, but other studies have been done in the past to support this concept as well. So we have the majority of our patients in corneal reshaping lenses who tend to be young, progressive, nearsighted individuals. Data recently has come out showing the prevalence of nearsightedness to be expanding worldwide, even within the United States. There's been almost a twofold increase in the percentage of people who are nearsighted from ages approximately 10 to 55 in the United States. I don't know if you've actually read this, Chris. This came out this week. There have been lots. I should send this stuff to you. The percentage of people with nearsightedness in recent surveys has really gone up. And so there's a lot more of a concern for the issues pertaining to myopia. And if, in fact, corneal reshaping does show to be a methodology that can slow down, if not halt, progression in young people, it can be quite beneficial.
What kinds of, it's not a therapy that works for everybody or is appropriate for everybody. If speak to the patients that may be landing on this video or this page, and trying to make a decision. Well, is my child or am I a good candidate for corneal reshaping or not?
The best candidates for corneal reshaping are patients who have mild to moderate nearsightedness, not high levels of nearsightedness. If we're talking about the powers of their lens prescription, if people understand that, we're talking about anywhere from minus 0.75 up to approximately minus 5.0. Okay? Some patients can be treated for higher levels of nearsightedness, but success rates start to diminish. The greatest success rates are between minus 0.75 and minus 4, but between minus 4 and minus 5, we still get pretty high success rates as well. As it relates to people with astigmatism, certain forms of astigmatism respond better than others. So it's hard to say in advance as a general rule, but astigmatism can be addressed with corneal reshaping to some degree. Anybody who has issues where they have a different prescription for far versus near, we call this presbyopia. They need bifocals. One can do corneal reshaping to correct their distance vision. They still might need to wear reading glasses for near, or you can treat them in what's called a monovision format, where one eye is treated for distance and one eye is treated for near, and many people can do well in that as well. Multifocal formats of corneal reshaping are being developed, but as of now not FDA approved. Our practice only treats patients that fall within the approved FDA guidelines, and we only utilize lens designs that are FDA approved for corneal reshaping. And that, to me, comments or suggests that we are, and this is a true statement, we are ultimately concerned and pay most attention to not only the effectiveness of corneal reshaping, but the safety profiles, especially when we're dealing with young people.